Hello everybody, I'm Dr. Mohammad Wakas. In previous lecture, we discussed introduction of malnutrition, types of malnutrition, and etiology of malnutrition. So in previous lecture, we discussed disorder of protein energy malnutrition (PEM) caused kwashiorkor, marasmus, and Marasmuskwashiorkor. So first of all, I will talk about marasmus. Students, it is a severe form of wasting. Marasmus is a common in children below the age of 2 years. It is a deficiency of calories in the body, including protein. Weight loss below than 60%, growth retardation and loss of muscle and subcutaneous fat, somatic protein compartment involvement, immune deficiency, particularly T cell immediate immunity, and no edema seen in this condition. So, if we talk about signs and symptoms of marasmus, students, in signs and symptoms of marasmus, there is a poor growth, sunken eyes, thin and bony face, ribs clearly visible through the skin. So you can see in this picture, students, there you can see ribs are clearly visible like that, and also abdomen is larger than normal also. So if we talk about clinical findings, so in clinical finding we see growth retardation, abdomen protuberant, extreme muscle wasting, skin and bones, loss of cutaneous fat, loose and hanging skin folds, old man or monkey face, no buccal pad or fat, things and buttocks are shrived, absolutely weakness, subnormal temperature, appetite is present, skin and hair changes are absent, edema also absent in this condition. So students, on the second is kwashiorkor, mainly deficiency of protein diet along with calories. This occur in 1 to 5 year at the age of 1 to 5 year in the children. Generalized edema or dependent edema present. And previously we discussed in marasmus no edema present, but in kwashiorkor edema is present. Visceral protein compartment involvement, weight loss greater than 60% and lower than 90%. Mental changes present, moon-like face, growth failure masked by edema, flag hair, and appetite is poor. In marasmus, we discuss appetite is present, but in this condition, appetite is poor. So now we have to discuss clinical of kwashiorkor in very big detail. So in clinical sign of kwashiorkor, first is edema. There is accumulation of fluid in the tissues, usually beings with a slight swelling in feet gradually spread up to the legs. Later hands and face may also have edema. After that is poor growth. Growth retardation is the earliest manifestation. The child will be lighter and shorter than its normal peers of same age and weigh about 80% or less of than normal. Sometimes, in case of gross swelling, the body weight may be relative higher. The child will also be wasted. The child arm and legs will appear thin as a result of fasting. After that is mental changes. Since kwashiorkor child has no trust in surrounding, the child will also be irritated, prefer to stay at home and in one position. So students, please see this picture. After seeing this, you can differentiate between marasmus and kwashiorkor patient. So please see this. So students, in kwashiorkor we discuss edema is present. So edema is like that. See, edema is like that. But in marasmus, legs are very thinner. So on the third number is Marasmuskwashiorkor. Sometime in area where protein energy malnutrition is common, malnourished children exhibit the feature of both kwashiorkor and marasmus. Such changes could occur during the transition from one form of severe protein energy malnutrition to another. These children will have extreme wasting of different degrees, represent marasmus, and also edema, a sign of kwashiorkor we discussed previously. Sign and symptoms of Marasmuskwashiorkor. Student, the sign and symptoms of Marasmuskwashiorkor is extreme muscle wasting, skin and bones, loose and hanging skin folds, old man, monkey face, absolute weakness, and also edema is present.